Disasters can strike in the Gulf region when we least expect them. Floods, hurricanes, wildfires, and extreme heat. Each one has the power to disrupt, to damage, to change lives. And kids are especially vulnerable. Every county in the Gulf Coast region has experienced at least 3 major disasters. Many have experienced 10 or more. Many communities were left vulnerable due to limited access to emergency resources, safe housing, and early warning systems.
The Pediatric Disaster Readiness Project was formed to strengthen both disaster preparedness and healthcare resiliency across the Gulf Coast region. This region is made up of 6 states and 1 territory and are the most disaster-prone and medically vulnerable regions in the United States. With support from the Gulf 7 Pediatric Disaster Network, Healthcare Ready led this effort, gathering data, forming partnerships, and ultimately turning insight into action to protect children before, during, and after disasters. This project began in Texas with a statewide guide we call an asset map. This map spotlights the different community resources that are available to keep kids and families safe during disasters. Did you know that 1 in 4 Americans in emergency shelters is a child? Disasters like Winter Storm Uri, Hurricanes Harvey, Irma, Marie, and Michael all revealed cascading failures that take place when you don't prioritize the pediatric healthcare needs. Most shelters and response plans still prioritize adults, leaving children, especially those that are medically complex or with disabilities, without adequate protection.
We designed this project to help emergency managers identify where resources are needed most, and to give hospitals, schools, and community organizations tools to strengthen pediatric preparedness and ensure continuity of care during disasters. The Pediatric Disaster Readiness Project builds stronger, more equitable systems that protect children before, during, and after emergencies. It also advances our mission to build resilient healthcare systems by centering children and family in disaster planning. Throughout this collaboration, Healthcare Ready led the development of the educational primers and helped translate complex data into accessible, practical resources. And G7 is ensuring that the materials and findings reach healthcare providers, policymakers, and community organizations.
The next disaster is coming. Children will be affected. Through the Pediatric Disaster Readiness Project, Healthcare Ready and its partners at G7 Pediatric Disaster Network are making sure we're ready this time, with the data, resources, and partnerships needed to protect every child, everywhere. Scan the QR code or visit healthcareready.org to learn more.